And I know that we've been keeping you all in suspense, but the time has now come for the logo reveal. So thank you again, everyone who voted during day one. We collected a total of, I believe, almost 76 responses, which is great. So it's wonderful to actually have a logo that's truly representative of what the people in the iHeart community want to see. So we're happy that we could do our process that way to get your feedback on the design. And without further ado, the winner was option C, the blue background logo with our red flower. So for those of you who appreciate the stats and would like to see the numbers up there in the corner, it was a pretty clear winner far and away. Option C, which appears as the orange in this pie chart, was almost 50% of respondents' choice. And the remaining votes were split fairly closely between the other two options. So this one was the clear winner. So very excited to move forward with this. And thank you everyone for taking part in the process. All right. And I think I will pass it over to Stephanie to help us moderate our discussion.
Thank you, Izzy. That is the one that I voted for. So I'm very excited.
I promise we weren't biased in the vote tallying.
I am ready to go with a new email signature, so get excited for that. Before we get started, I just wanted to take time as we're coming to the close of our summit to thank everybody for being here, and not just for being here, but for being so incredibly engaged throughout this entire process. It is it's beautiful to see the kind of camaraderie that exists within this community. And as somebody who is new to this space, I want to thank you for not only accepting me into the fold, but for welcoming me with open arms. And I just want you to know that Izzy and I are here and we are ready to work and ready to put a lot of these ideas that we've talked about into practice and start getting some real results. So again, feel free to email us at any time. We're happy to help. We're happy to offer any advice that we may or may not have, but I assure you, if we don't have the advice, we know somebody who does. So we can definitely go ahead and get those emails in the chat again. But for now, as we close out, we wanted to have a casual discussion about takeaways from the summit, things you learned, things that you didn't know that you wish you had, and things that you want to take back to your programs, take back to your community, or things that you wish we had talked about for future summits. So I'm going to go ahead and open up the floor and let anybody who is interested in sharing go ahead and share.
A lot of great information. Those projects, their information is wonderful. I just want to get a copy of the notes so I don't lose the ideas, because they can help as we all look at improving what we're doing. And that's my big takeaway, because there's a lot of resource information we received. And I just want to remind everybody that even if you just do one thing different from this meeting, we've gotten one step closer to where we want to go, because it can get overwhelming. So that's it.
Thank you. And I do want to add as well, that Google Drive, which I've been sharing with copies of the presentations, I'll be adding the novel presentations to that as well, so that you'll all have access to those. You will continue to have access to that Google Drive folder, so please do feel free to make use of those resources in there. And we'll also be following up with sort of a brief summit recap, which will be sent out to everyone who attended today, which you're also more than welcome to disseminate within your community with your colleagues, so they can get some of the summit takeaways, even if they weren't able to attend for all or any of the summit this year.
If everybody's going to be shy, I have a question. We are charged with, and it's something that I think we're all interested in doing, but don't always know exactly how to do it, either at a local level or a national level, and that's systemic change. But it definitely, we promised to try to figure out some ways to make systemic changes. And in our little regional group, well, it was the cross-regional group. One of the things that was addressed was family support and or lack of family support. But many of us who work with families recognize just how stressed our families are and that they're not always able to provide the support. And that's why in our programs, we always invite families to be part of everything. Particularly in a program like medical school, families are not as aware, that need help understanding the demands of some of this programming. But when I think about systemic change, I mean, ideally, IHEART would be addressing poverty, housing, the big issues, right, that we know are impacting our communities, but we can't. We can't address all those. We could, but I don't know that we'd get very far if we just threw everything out there. So what are some ways that we can think about systemic change from an IHEART perspective? Does anybody have any ideas that we might think of in the future? I mean, we're all talking about great things like pathways right now to move our students through. And of course, those are part of it. But what are the really groundbreaking things that we need to be thinking about? Policies, whatever. Adrian, you leaned in. I'm going to ask you.
Mary, you're too observant. No, one of the things that I thought, well, thank goodness we have that cross-pollination breakout session, because they presented sort of what California had said about needing data. And I think that's for each of our regions, we need data as far as to really assess what our needs are. Like, what is the graduation rates? Like for me, covering those 5 states, what are the graduation rates of Native Americans in those 5 states that the Southwest region covers? Where are the community or the tribal colleges in that community, and what are their graduation rates also? Because then if we find that maybe one tribal college has a really great graduation rate, then we can try to partner them with other of the tribal colleges and see what things are being done. But I think it's really data that we need in order to do. And then the other part is just that would be part of our needs assessment for there. And I think the other part we talked about was mentoring. And as I said in the regional groups, was that the other mentors we need to remember are just like you said, our family mentors, but our peer mentors, because I could not have been successful if I didn't have the other medical students who were Native in my cohort who helped me to be successful, who babysat for me when I needed to go study, who were there for me. And so we need to also, like, they were my mentors, and how do we also provide them with mentor training? So I think those are the 2 things that I thought about.
Thank you, Adrian. That's fantastic. How about if we dedicated part of our next, like our next IHEART is going to be right before AAIP in September. If we dedicated part of that time to a review of the data nationally, a data review within each and at the different levels of education, right? I think it would be really good. That'd be a good way to show how we each have different fights, or our fights are a little bit different. Like for us, we are really having to emphasize K through 12, given how low our scores are here. But that might not be the case in the Southwest. I don't know, just as an example. Yeah, I like that a lot. AIP, something I've always wanted to do there is to have a table where the healthcare providers sign up to be mentors. So we engage them right there. And then the students are all there as well, but it's not all the health professions. So that's a little bit of a problem. But we could start with that and then go to other, like the public health conference. Someone could go to AJPH, or no, that's the journal, the American Conference for Public Health. Yeah. Great, thank you. Other ideas? Thinking outside the box. Melvina, you've always got an idea.
Well, I think one of the things as a mentor to medical students over many, many years, native medical students, the thing I heard over and over and over again was, these are the expectations from medical school, and I have to fulfill them, but my family wants me home. My family wants me to come home and take care of my sister, and I can't. So I think including a component of family in any of our interventions that we have, including family also in those interventions that we have. So there's a greater understanding about what medical school is all about, and a greater understanding about what the person that in their family who wants to go to medical school, what the demands are. And yet, we still have to honor that tradition where you take care of family. So I think it's including family in any intervention, or as many interventions as possible, but also educating the academic centers, the institutions of learning, whatever they may be, the nursing schools, whatever, dental schools, that it's different. The cultural values are different within American Indian community. So getting at the culture again, but also not only including the family, but also educating the systems. Because again, like I said yesterday, it's a systems issue also. And that's one thing that I think we have to address it. We just have to. And this group is the ideal group to do it because no one else is doing it and no one else is going to do it. So I would strongly, strongly recommend that. So, making sure families are included, and then also looking at the infrastructure of institutions and seeing how they're hampering, how are the institutions hampering the education of our students? And they are. There's no doubt in my mind that they are. So I would say broaden it to that level also. There's something else I was going to say. Another. I'll think of it later and maybe bring it back, but I can't right now. Those are the big ones for me.
I love that, Melvina. It makes me think of two things. One, IHEART could come up with best practices to serve Native students. Yesterday, when the 4 students were on, I commented that their stories were common, and I didn't mean to insult them in any way. It's just that those of us who have been doing this for a while have heard those challenges from so many of our students, and not those exact challenges, but similar ones. They're not, yeah, we see them so often. And so we could write for best practices for anybody building these programs. But I like your idea too of that could be a policy change that we advocate for medical schools. We could come up with a list of policy changes. Right now, our school is working with the other schools of, dentistry, pharmacy, because their admissions policies are a little draconian compared to our own. So that's an example, I think. This is a perfect example for other schools. Thank you, Melvina.
I do just one more comment. I know my other thought what that was educating within the systems, educating our students within the systems. It has to be brought to their attention that Native Indigenous learners learn differently than Western medicine. And a perfect example was one time I was called into the emergency room by the emergency room attendings because they couldn't understand why one of our Diné residents wasn't getting it. They said, he's not getting it. So what do you mean he's not getting it? He doesn't understand what we're trying to teach him. I said, well, tell me what's going on. So they did. And I isolated it after going through it all to the fact that that Native learner is a circular learner, not a linear learner. And they were, especially the emergency room, they were taking it from linear learning. And what I showed them, demonstrated to them through some of the comments that he had made and how he was thinking, what his thinking process was, that circular learning. Now, then I asked him, well, how is he doing on the testing and et cetera, whatever, the procedures. Oh, he's great on that, but we don't think he's learning. And I thought, well, if he's doing great on that, then he is learning. It's just that he's not conforming to your type of learning, which is linear. So, I mean, there are so many different examples of how our students learn differently. Visual is another one. Having visual aids all the time, makes it very, very important when you're trying to educate. But there's a whole bunch of things. But anyway, that's the other area that I think I wanted to make comments on.
I think another one is when medical schools insist on starting with the tiny and then going big instead of giving us big picture so we know why something's relevant and then bringing it down. And I don't know if
Right.
other programs do that, but it's just so hard to learn for so many of us that way.
Hi, can I add something really quick?
Please do. Please do.
This is the first summit that I've attended, and I am new to the healthcare professions. I'm a tribal liaison with OU at the Stevenson Cancer Center, but I have been working in higher ed, specifically with Native American students for a while. I was working on a project with the California Community College system to try to recruit and retain Native students within the college system. But one thing that I really didn't hear emphasized, and I know that it's an issue with our students going through the community college system in California, is cost. So more knowledge on financial aid, how to fill out financial aid applications, scholarships, how to fill out scholarships, what resources are out there to help students that want to go into healthcare professions, that want to go into medical school, because right now what we're seeing is a lot of these students are, along with everything else that they have, going on in the roadblocks that they have to go to college, just in general, is the cost. Like, how is it going to be worth it? Why is it going to be worth it? How am I going to pay for this? Right now with, the student loan issue, with people worrying about how they're going to pay it back, how it's ballooned out to be this really, really big detrimental thing that's keeping people from going to college or making people act like they regret going to college. That's something too, I think, that needs to be addressed, especially when we're talking about reaching out to the younger kids to get them on the path to college, is to let them know that there are things out there to help them pay for school. There's programs out there to help them pay, but there also needs to be more emphasis on helping them fill out the FAFSA, helping them apply for scholarships. I was the scholarship specialist for my tribe for about a year and a half, and just some of the essays that I saw come through, just even helping them to write their scholarship essays, I think is something that really does need to be addressed. Thank you.
Thanks, Iris. I think that's an excellent point. One of the things I see in medical school, well, I know from the data that our students come in with higher debt load than most. And as a consequence of that, we see things like, credit card debt. So even when people are moving along in school, they're also on the side playing these credit cards because they can't put those off. They can't. I forget what you call that when you put your loans on hold for a little bit. So they have to keep paying that. So often, so I've seen students do things like take extra jobs in medical school, which of course is never advised. So you make really good points. One, how do people who are not quite there, how do they afford it? And then for those who are on their way, how do they make sure that they don't become hampered by debt so that they can actually attend to school? All right, I see more faces coming on. There might got to be more comments then. Yeah.
I wanted to highlight that Michelle Singer too put a great video link in the chat to check out.
The idea of becoming an accomplice instead of an ally, I think we captured that. That's great. Pathway for a student on the student side. We have talked about a little bit, thank you, Karen. We have talked a little bit about not just recognizing the health professions that we're all used to, but also entry fields through EMT. I've had a lot of medical students start as EMT, so bringing that as part of your science fairs is not a bad idea. Even CNA programs. And then always remembering that the tech fields, a lot of our community members value those jobs, and so introducing those. Okay, Leanna, your turn. I'm pulling on all my buddies here.
Thanks, Mary. You can tell my wheels are spinning. So I guess for me, the past couple of days have been, it's been great. I think we've brought a lot of new energy and some, sort of different folks to the table. And for me, as I'm hearing all of this and kind of thinking about where does this take us, I do want to sort of circle back and remind us, because I feel like this is what I'm hearing right now, this kind of end of day, like, where can we go and what are all the possibilities, is part of the problem of getting anything done in this space is there's so much work to do and everything hinges on something else. It is an ecosystem problem. The entire ecosystem needs help, and we all come from different parts of it, and we all come with the intention of wanting to see the ultimate product be our workforce that reflects our communities and serves our communities, and our communities are healthier. I just want us to make sure that we stay true to the purpose of iHeart coming together, recognizing that we are not going to be able to solve all of those problems, but we should keep them all in mind as we develop programming, or as we model programming, or as we improve what we already have and think about things differently. That in relationship to iHeart, we're really, I think our goal, Mary, was to sort of say, everybody's working so hard. Why don't we come together and share what we're doing so all of us don't have to keep working so hard, and that we might actually accomplish something in terms of creating the change that we want to see. And so I love all this passion and energy, and it just, like, we could talk for hours about what about this piece and this piece and this piece, and we should never forget them. But tangibly, I want to make sure that when we spend time together as an iHeart community, that we're remembering that our goal is to be able to make resources available and accessible to more of the people that we're trying to do this for. And so, yes, it's important for people to understand the financial impact and that, but hopefully people are building that into their programming, right? Like that does exist. There are people like you, Iris, who were the scholarship person at your institution, but did people know that? Did they know how to access that? And so iHeart's function really is bringing the resources together and elevating those voices and amplifying it if it's a great idea, if we can, but keeping true to our mission. So that's what I'm hearing. I'm like, I love all the passion, but I feel like that's what catches us up sometimes if we spiral into trying to solve all the world's problems and
No, I completely agree, Leanna, but I think that we can take some of these and, like, the including families. It's critical that all of our programs include families.
Yeah,
So why
no,
can't we make
I
a best
agree.
practices that we share with each other? Yeah, and share
I
with
totally agree. I also
people.
think that there's space for iHeart to be a conduit for best practices.
Yes.
So first it's like, what are all the programming, and then best practices. And I was even hearing, how do we also be a space for, sort of helping people with their advocacy effort, right? So learning from each other as we are advocating in legislative spaces or in educational spaces or institutional spaces. Can we be the hinge point for that too? I totally think that that's important to incorporate all along the way. I just don't want us to get caught up in creating programming. I guess that's what I was thinking, is that iHeart isn't here to create programming. It's to leverage all of this wonderful resource that we already have.
Absolutely. And leverage it and also showcase it, like having, webinars like we talked about that would educate. iHeart could do a webinar series, and that's not beyond our scope. What are you going to be, our iHeart police now, Leanna?
Stay true to our mission. I'm mission driven. That's what I do in admissions, right? I have to stay to the mission.
I love it. I love it. I saw Chelsea here. You had your hand up. Where'd you go? Someone had her hand up. I'm sorry that we missed you.
Hi, yes, this is Chelsea.
Go ahead, Chelsea.
Hi, so my name is Chelsea Rangel. I'm Navajo, and I'm in the Western North Carolina area. I work with a mentorship program that has built a pathway to healthcare through a program called MedCat. And what we do is we've partnered high school students with college students. And it's been really beneficial to see how that relationship's developed and the kind of support the college students offer because they've been in the high schooler shoes. Another thing I wanted to share with the group is some information. When I built this program, I really wanted to find a curriculum geared towards American Indian, Native American mentorship. And I found one through Campaign for Action. And it's, let me get the title. It's titled Pathways to Promote Academic Success for American Indians, Alaska Native Nursing Students, a mentoring curriculum for nursing faculty. And it's a brief toolkit that offers different mentoring programming geared towards Indigenous students and how to incorporate their culture and think of more of them as a whole rather than them as someone to go to school and to learn. So I'd like to share that with everyone in the chat if I could.
All right, thank you. Any other comments?
There was a question in the chat, Dr. Owen. It was, what is the connection between this group and NIHB and the Tribal Health Conference? And we had a couple of comments after that saying that's a really good question. So I didn't know if you wanted to field that.
NIHB primarily, and catch me if I'm wrong, Adrian, Leanna, and Melvina, but or anybody else who knows NIHB pretty well, is I think of it as a national policy maker and also influencer in Washington, D.C., who serves the tribes, serves all the Indian health boards and the tribal, our IHS clinics, our tribal clinics. I know not IHS specifically, but they do advocate for Native health, and so they are influencing they bring everybody get together for the formulation of the IHS budget. Lancer, I see you nodding and shaking your head. So anything else to add to that?
No, that's it. You hit it in the head.
Miigwech. So they're not as focused as we are on the pathways. They have to be attending to, you know, the tribe, more direct, the tribal leader needs of, particularly in our clinics and our health systems. It's a good question, though. We should be at NIHB, and if I had got my act together, we would have been, but next year.
Well, and I think that was my point more than anything was the Tribal Health Conference itself and representation there in order to be discussing these, because these all have this has a definite role in what the tribes can be doing in terms of their health systems.
Yeah, Dr. Muski's made that point really well. Totally agree. And we can, you know, that's some of the policy work that we can move toward as well. But I think it's behooves us in each region to be reaching out to our more local and regional IHBs and tribal clinics. And, you know, yeah, just all of our tribal clinics, and trying to influence there, get to know people on that level. And then as we grow and have more, are more solidified in our ideas and what is really important for policy, then I think it makes more sense to start going to NIHB and getting in front of the crew there. But just showing up at the conference so that they know who we are is a great idea. And again, I would have done it if I had my act more together. But
just a quick comment on that, Mary. Yeah, we need to do another presentation at their next conference in a year. They do have, I think this one is for the tribal programs. They also have a tribal public health conference, but AAIP actually plans to develop a relationship closer with them. And I just submitted, they do a lot of providing of comments on legislation or CMS recommendations, and I just submitted comments regarding traditional health because it was their plan is lacking in a number of areas. So I think we do need to team up with them, and hopefully in the near future we will get those relationships stronger. Thank you.
Good luck. Been trying that one for a while. But I think our group certainly has to engage them if we're thinking about policy at some point. Same with NCAI, National Congress of American Indians. All right, Michelle Singer, let's take that as the last one and then we're going to close out, okay? Go ahead, Michelle.
Yeah, hello, everybody. Michelle Singer, she, her pronouns, citizen of the Navajo Nation. I'm with the Northwest Portland Area Indian Health Board with the Healthy Native Youth Project, which Selena and Grazia are my colleagues and did a great job. Some of the discussions that were shared about family support, mental health, and the support of, for all who are involved in these pathway programs. These are ideas that our adolescent health team, as well as regional partners, have been discussing and look forward to continuing to develop either in implementation plans or templates that could be adapted perhaps for tribal schools, for tribal colleges, perhaps even institutions, those who engage youth. But really also too, I just have to make a plug for everybody who is here because, coincidentally, we just did a Healthy Native Youth Community of Practice today about being a good relative 101. And the whole idea is we have to take care of each other, the identification, the community relationship, the taking care of the whole person. If we don't do that for ourselves as those caring adults, we're really not going to go far in our institutions and or with our youth. And so our board has many, many materials to be able to support both caring adults, educators, as well as youth. And I just appreciate, this is my first time. Many organizations I know on here, and it's good to see folks. A lot of this stuff is already being rehashed out there. So I really, really encourage the meet and greet with NCAI, National Indian Health Board, NIEA, AHEC, NCUI, American Indian College Fund, ACES. Work's been done, but I think this is a new layer with you all coming to the field. So thank you so much. Congratulations.
Miigwech, Michelle. And with that, let me close us out or just talk about what happened over these last 2 days. Well, actually, Dr. Paul Hunter covered yesterday really well. And then today we added on with some good regional discussions about how to communicate across across each path or across the different regions. And we came up with ideas like the videos and using a newsletter. And those were just a couple among many. We came up with other solutions that have been discussed. Were discussed quite a bit yesterday as well. We had a fantastic presentation on DEI by Dr. Muskis and Dr. Acosta from the AAMC, and Dr. Muskis, of course, from University of Washington as an admissions. And I might add, one of the only 3 associate deans of Native Health, or associate deans in the country who is Indigenous, Miigwech. But they had a fantastic conversation and gave us some good tips, like for instance, a few that I heard were understand the actual law when we're looking at these DEI laws to make sure that we understand them thoroughly and completely, and that we get an expert in, particularly someone who knows tribal law really well, because oftentimes we find that people don't understand who we are and therefore don't apply the rules well within our own institutions. He also recommended go local. This is actually a recommendation as well from Dr. Muskis. Go local, use your local allies. In particular, make sure that our tribal folks know what we're up to and how we are their allies. And this, makes me think of the NIHB conversation that we had today. We definitely need to be involving all these allies. And IHEART is open to these allies. It's focused on recruiting on bringing together educators at all levels and health professionals, whether the health professional is a formal educator or not. We're just all working together to get more students through our system so they can become health educators, or at least just get through our system and have better health outcomes. Also heard the good point for the DEI talk about advocating with stories. There are plenty of groups that have the data already. For instance, the AAMC has great data. We can access theirs and then add our stories. And we heard yesterday from 4 young women with incredible stories. And again, those are not rare in our community. We often take circuitous routes to get wherever we're going on our journey. And I know all of you folks understand that who have been working in this field. And then, of course, educate, educate, educate. He made the really good point, and we all have experienced this, that that surprise that we get when someone doesn't know about us, anything about us at all, or the issues that we're facing, and how often we have to re-educate, not whether it's legislators, whether it's the people we work with in our own building, but over and over and over. We heard about some novel programs, including Doctor for a Day, where medical students are are meeting with young community members and teaching them about what it means to be a doctor. Most impressive to me were their outcomes. They had of the students that they surveyed after this program, 82% said they had a better understanding of what doctors do, and 78%, more importantly, felt that this doctor educational plan or path was achievable. That's huge and phenomenal. We are healers, which basically is a technologically interactive pathway. I'm sure I butchered that, but allows students to access a pathway in a way that they might find more achievable. So and they had lots of different formats. I love the texting that they can do. I know that texting has been used for suicide hotlines, and this is similar, but students can go and just find out what's next on the track. That's an incredible program, very powerful. Also heard about 2 programs that emphasize the incorporation, and this is really exciting and hopeful to me. We're seeing this more and more. Programs are incorporating Indigenous knowledge into academic programs, into research. And as we get more of us as we are more successful with IHEART and other programming, and seeing more of us push this into academia and research, we know that that's going to eventually influence the outcomes for our communities. It's a long, slow road, but this is the way we do it. We're not going to just show up and do things as usual per academia. We're going to start bringing our ways in there because we know that they're better. We also heard we just now had that great discussion on some of the takeaways and some of the things that people would like to us to think about in the future for IHEART. And as Dr. Leanna Muski's pointed out, we have to be judicious about moving forward and making sure these are something that we can continue to do. That are sustainable and that we have the time for, because we are all overworked in our jobs. So we just talked about those. I won't rehash those. I do want to thank you all for being here today in community with us and helping pave the road. We know this is still a long process. We're no longer building the plane as much as we're flying it. I think we got a couple pieces on now, so we don't have to be quite as unsteady in the air. But we still have a long ways to go. And with that, if nobody else has any other comments, I'll have Megan Lotka close us in a good way. But I'll remind you, we do have an in-person conference on, I think it's September 4th, the day before the Association of American Indian Physicians Conference. We recognize, we really want to emphasize that IHEART is not about creating more physicians so much as creating more health professionals in Indian country, growing our own. And so we will rotate where our conference happens in the fall. It just happened to be a good opportunity for us this year. So Megan, can you close us out in a good way?
Anin intana wima ganadu. Migwich gichivanadu. Migwich ga kenagigu. Ga eje chigeyan. Nungam. Migwechka eje mashkeki. Migwechka eje gakenua madewin. Migwechka eje bida dezeyan. Weweni bim bizeoyag. Gigawabamen menoa. Hello, my relatives. We're thanking the Creator. We're thanking the Creator for this good life that we have together. We're thanking for our good weather now in the springtime. We're thanking Creator for our medicine and our education, and for this good life that we live. And weweni be mebezoyeg. Go carefully wherever you go. Gegawababin menawa. See you later. Meet you.